All right, welcome one more time. This is a cool show. It's the lighter side with Dr. Ortiz. That would be me. I'm a weight loss surgeon, a bariatric surgeon. I've been doing this for many years, and it's the lighter side of a very heavy topic, which is, well, excess weight, metabolic disease, metabolic syndrome. Metabolic wellness is a concept that we're going to be talking about very frequently over the months, and we do this on our online courses for all our ex-patients or patients that had weight loss surgery, our OCC family, let's call it. But it's a topic that should be handled by everyone, which includes adolescents, young adults, and older people. The older we get, the more metabolic syndrome we have. Anyways, we'll talk about that during the next 20 minutes. This is a short segment. Let me start off by saying that I have a guest today, and we're going to have a quick interview. And we've got a great interview, in fact, because you're listening it directly from somebody who's lived the experience of going outside the country for weight loss surgery. And that's what the topic is today. It's how to find safe weight loss surgery in Mexico. And of course, I can toot my own horn, but I'm not going to do it. You guys do it for me. Ha! No, yeah. Well, maybe. I mean, some of you guys that have undergone surgery and recommend us highly, and we so much appreciate it. But at the end of the day, you're helping other people because they're finding hope. They're finding hope in sometimes a hopeless world where either the access to the care in the United States or Canada or other countries is not there, and if it's there, it's extremely expensive. It's basically prohibitive from a cost standpoint, and if it's insurance, sometimes it's not covered by insurance, so or very difficult to qualify. But anyways, before we go into our interview, I just want to go ahead and go with some brief questions that were already posted online. Let me see if I find my. There you go, the online questions. And one of the online questions is it safe to have weight loss surgery in Mexico? Surgery in itself is, and let me start by saying, surgery itself can be risky depending on what type of surgery it is, if it's scheduled, if not. But weight loss surgery in general has been now accepted to be a very mainstream procedure, and in fact, it's the best way to acquire quick and effective and permanent metabolic health. But we'll talk about the destination more, because the question actually says, is it safe to have surgery in Mexico? And I'm going to go to the next follow few questions, because they all basically are asking the same thing. How do I find a center that follows U.S. standards for health and safety? And yes, every doctor and website claims that they're the best. How do I find the best option for me? These are really, really solid questions that everyone can have. And I'm going to answer those before I answer this last one and then go into my interview. But going back to these claims that are on every single website. You're never going to find a website that says, well, we're the terrible, don't even come to us. Or that, yes, we've done so many procedures, but half of them have had complications. You're never going to find a website that really or is completely transparent, especially when they're self-promoting. So one of the most important things you want to do, and I'm going to switch back to us, is that the only way to really know for sure if a service outside the country is up to par with American standards is by American accreditations. And that's why health accreditations are so important. The most important one in the United States is Joint Commission International, and that's an accreditation. That's an organization. That's a third party, an organization that goes to the hospital and looks at every single facet of healthcare, and then surveys that institution, and then gives it a final score and says this is a great institution or this institution is lacking. And the only way to actually get that golden seal is by having an institution that passes every single of those features of safety and quality. And look, if you're looking for weight loss surgery and you're looking for a Joint Commission accredited, we're the only one in northern Mexico and the only standalone center in Latin America. But you know what? We can talk more about that, but I know you guys want to listen to our guest. So what we're going to do is we're going to welcome Desiree and start talking to her, because she's got a lot of information that she went through when she decided to come down to Mexico. Hi, Desiree.
Hi, Dr. Ortiz. Thanks for having me.
Thanks for coming on. I heard you were nervous.
Yeah, I mean, I feel like I speak pretty well, but I get scared that I'm going to lose my words, and and also you have such a great personality. I want to make sure that I can shine too.
Thank you. Flattery can get you anywhere here. That is awesome. Well, so tell us first of all, how long ago has it been since you had surgery? How much have you lost weight?
5 weeks, and I have lost 37 pounds.
Wow. You're a newbie.
Yeah. 5 weeks ago tomorrow, or 6 weeks ago tomorrow. So I feel great. I've felt great. I traveled all the way from Tijuana back to Wisconsin. Um, and it was pretty easy. It's been a really awesome recovery.
That is one. And how did this all start? Is weight loss surgery something that you had been considering?
So I am a mom of a 3-year-old and a 1.5-year-old. I've always struggled with my weight, but and I have PCOS. And so it took me quite a while to have my boys. But after having my boys, I realized as I'm aging, my weight was really holding me down. I wasn't able to do the things I wanted to with my boys the same way I could do when I was younger. Like when you're younger, it's almost like you can compensate for the weight. And as I was aging, I was realizing I just don't have the strength, I don't have the stamina. And I've been on every diet. So it was before Thanksgiving, and I was on someone's Instagram, and they had been talking of that they had VSG. And so I looked into it here in the States. And for me, it was going to be a really long road. And I knew that I didn't want to possibly go down that road and it not be approved by my insurance. So I started looking at a doctor that was recommended by someone else in Tijuana. Now, I'm someone that does a lot of research. So I was looking into this doctor, and, on the surface, it was a lot of really positive things. And then I kept digging deeper, and I found some things that I just was not loving. But I had already made up my mind that I wanted weight loss surgery in Mexico, and the affordability there was the right solution for me. And it's a long story, but I found OCC and Dr. Ortiz through that search.
And okay, and those are the questions that I'm getting, and I get them online often.
Mhm.
And it's like, well, how can you tell us that you're the best and everybody else says they're the best? In fact, there's imposters that have my same name, right?
Yeah.
And are and the truth is, let's put it this way. First of all, from a historical perspective, I basically have been doing this for 25 years. When this wasn't even popular, when weight loss surgery wasn't there, I was a young surgeon back then, and surgery was basically in its pioneering phase, and then it's grown to what it is today. So ultimately, my obligation is to my patient, and my dedication is to my patient and to their final outcome. And having said that, well, that's why we've pioneered so many procedures, and that's why we do surgery on patients that don't have an option in the United States, or is very difficult, like yourself. But ultimately, the self promotion part is something that you have to be able to advertise what you offer, but at the same time, you always want to have uh, credibility and transparency. What
Mhm.
was it that you saw that made it different and make your decision easier to follow us or to.
So when I went to your website, you had a lot of awesome stats. And when I dug deep into your stats, they're all true. Um, and then when I did a simple search and I put keywords in regarding safety and looking at reviews, literally I couldn't find anything negative. The next step was you guys have this amazing Facebook community. So you have all of these support groups. And what I really loved about that was I could go in and I could see real people talking in real time about upcoming surgeries they just had. And the moderators there really let people talk. You're getting the real truth. So that was really comforting to me. These groups have 5,000, 6,000 members. So I knew that these people that were having these positive experiences were real people that I could look at their Facebooks. Also, when I went and I looked at your safety record, it was really positive. And I know that as an American, we value safety. But when I was looking at your record and the work you've done, it was comparable, if not better, than a lot of the places in the States. So I knew that this was the right fit for me. And also I knew that I would have to back up my decision to my family and my friends with the research. So I made sure that I did that. And when I sent it to my friends that were nurses, when I sent it to my friends that were doctors, when I had to show my husband, they all felt confident, and that continued to make me feel confident in what I was choosing.
Yeah, 30% of our patients are nurses. Many doctors. We're all pain in the butts, though.
Mhm.
And I just kidding. I've got a ton of doctors that are patients from the U.S. and yes, we're their logical choice simply because it's not just the track record, but it's all the accreditations, and that's why I do it. I do it out of respect for people. I mean, yes, we can toot our own horn. We're not about that. We're about education. But yes, you want to have the comparison. Say, well, what if I went to X, Y, and Z in the States? Well, they're basically the same level of accreditation, quality, etc. Obviously, we're highly specialized in weight loss surgery, and we've been doing this for so many years that we've trademarked procedures, we've patented devices, etc., because we've been doing it for so long. So this COVID-19 pandemic just basically came and disrupted even further the traditional healthcare systems. The globalization of healthcare is here, it's here to stay, and going out of the country for a procedure is not as unusual as it used to be 20, 30 years ago. In fact, in Mexico, we've had most of the devices that were life-saving 10 years before they were approved in the States, like heart stents, like surgical devices for vascular, for weight loss, etc. So those things are to be taken into consideration when somebody's looking into another country. So you said you shared this information with medical community, people that are close to you.
Yes. Oh, I'm sorry, I missed your last question.
Oh.
One of my best friends is a nurse, and so she had a lot of questions, and she checked you guys out. And when I was recovering in surgery, she was checking in on me saying, did they do this? Did they do this? And I said, yes, yes, yes. She made me take pictures of my incision sites, and she's like, oh, those look great. Those look perfect. So I had the backing of the medical community here, and I felt comfortable because all along the way, these people that I trust here were like, this is legitimate and this is safe, and they're doing right by you there.
Well, let's talk about your specific situation. You were looking for weight loss surgery because you needed to lose weight. Did you know that the PCOS was going to resolve with the surgery?
I didn't initially. Initially, I was just trying to lose weight. But as I've gone and as I lose weight, it's a little TMI, but I'm having regular menstrual cycles that I have not had in over a decade, just from losing that initial 37 pounds that I've lost. I knew that it was definitely a possibility that it would help, But after the recovery, after the first couple of weeks and feeling tired just as I was healing, I have more energy on way less food than I have ever had. And I know that part of my tiredness was because of my PCOS. So for me, losing weight and VSG has been very helpful for my PCOS.
Well, it's gonna cure your PCOS. And for how would you explain PCOS to our listeners? What is PCOS?
So I have, for me, my PCOS shows up as irregular menstrual cycles. It caused a lot of infertility issues for me, thinning of my hair. I know that it messes with your hormone levels. It makes you tired. It's just a lot of like inside imbalances, chemical imbalances, right? Or hormone levels. And so for me, it just wasn't allowing me to function at my best.
So PCOS, polycystic ovarian syndrome, is a syndrome. It's a signs and symptoms that all are characteristic of a disease, which is now we understand it from where it really truly comes, which is high insulin. High insulin is part of metabolic syndrome. High insulin, insulin resistance is basically the big pandemic that the whole adult world is living, and a lot of adolescents as well around the world. It's the big pandemic because it doesn't even, COVID-19 doesn't even get close to it. Around 30 million people die from the effects of uh, metabolic syndrome, which results in diabetes, in cancer, in Alzheimer's, in dementia, in cardiovascular disease. Those are the big killers around the world, and they're all associated to basically this. Not to mention infertility in men and women, erectile dysfunction in men, and in women, it's PCOS. And so I'm glad you're sharing this because it's difficult. I mean, I appreciate you sharing this, but a lot of people need help in understanding that they may need medical help when they're feeling all these different situations you were mentioning, the infertility, the painful menses or the irregular menses, the hair thinning, there's the body fat accumulation. There's so many different signs and symptoms. But ultimately, what happens is that we went to the root cause. The root cause is too much insulin, and weight loss surgery dramatically changes your insulin levels in a matter of 3 weeks. So if you have high blood pressure, high blood sugar, it reverts in a matter of weeks, and suddenly you're not diabetic anymore, you're not hypertensive. Thus, the risk of having a heart attack or any other complication from that immediately diminishes or abolishes. Now, in your case, you've been out several weeks. How has it changed? Tell us from the moment you had surgery, how has everything progressed?
So having surgery, being in the hotel was honestly a great experience. They take such good care of you there. And the OCC staff lets you know all along the way where you need to be, what you need to be doing. I came home and I slept. I got home late and I slept. And, I still had a little bit of like cramping as I was progressing. But honestly, I am happier than I've been. I have more energy. My healing, I feel great. My clothes fit. I'm wearing jeans for the first time in, I don't know, a decade. Uh, so, my journey has been really awesome. I have the energy to work out. My current struggle is getting all my liquid in. My stomach is hard and it is a balance, but I'm getting there. I mean, my stomach is small, but it's a balance and I'm getting there. But really, my husband has noticed the difference, my friends, my nurse friend. So it's so far, it's definitely a learning curve, learning to deal with the reasons that you overate and got to where you were. And it really puts that out in front of you and you have to deal with those issues. And VSG allows you to deal with those issues. And it's the journey's continuing, but for me, I would do it 1,000 times again. And also, I've never had surgery before, but I consider myself a baby when it comes to pain. And for me, it was really easy.
Yeah, it's pretty straightforward. We've got it down from that aspect. It's a tool, and you're using it correctly as a tool because you're open to learning as it progresses. So you're getting our education program delivered online via email, those videos. Tell me about that. How can you describe it to those that are looking for a whole program, not just a weight loss surgery?
So they have people that call you and check on you numerous times along your journey just to make sure that you're okay, you're feeling great. They have these screeners that you get that are followed up by a call as well, just if you have any questions. So someone's always checking in on you, and they have a list of like to look fors. And then you get emails daily with just tips and sometimes recipes. Sometimes, hey, you might be noticing this. Here's a way to fix it. Here are suggestions. Always reach out. I always feel very heard by the emails in the questions. And one time I didn't respond to a survey right away, and they were calling me like, hey, you need to make sure you respond. We need to check up on you. The videos have been really helpful because as someone that has been on 1,000 diets, you think you know everything, right? Because you've been through every program. But it's been really awesome to have Lucia just reach out and continue to learn and to continue to grow. And, I didn't know all the things about protein and supplements that I need to know to make sure that I'm getting the amount of energy I need with the calories that I'm getting in. So I feel very taken care of. And I know that if I have questions, I can always reach out.
That's wonderful. And you're just starting your journey because you've lost 30 something pounds. What's your weight loss goal? How many more pounds to go?
So my end goal is 160. So I've got 43 more pounds.
So basically, you've lost almost half of your excess weight in a matter of 5 weeks.
Yeah, almost 6. Yep.
And one thing that's going to happen, if it hasn't happened already, you're going to stop losing weight, and then you're going to say, "Oh my God, what happened?" But then you're going to be losing body sizes, and you're going to be, "Okay, has that happened to you?"
Last week I lost 2 pounds, and I was like, oh, that's not the 5 pounds from the week before. And then I put on a dress for work, and I turned around in the mirror, and for the ladies, there was no back fat below my bra. Like there wasn't a roll of back fat. And I was like, okay, so it was 2 pounds, but my back looks amazing. So I'm going to take it. And that's what I am like holding myself, those non-scale victories. Being able to wear jeans and pull them up and feel comfortable and confident has been really amazing. My face, I don't know about you, but my face looks amazing.
I agree.
It's thinned out a ton. And my hair, it's, the supplements and eating well and the PCOS, I have a lot of regrowth happening. So I'm seeing all these non-scale victories when, the weight loss is 2 pounds, 2 pounds. Even that is a lot, right? Even that I'm not shaking my head at. And I know it's going to continue to slow, and this is a lifelong journey. And I'm really holding on to the other things that I can see.
Well, I think you're going to be a great influencer. The influencer program that we created is basically empowering people like you that have undergone the journey, that have struggled a certain amount of life to get their health back, and then suddenly are blossoming into that health, metabolic wellness that we all desire. But our idea is to feed you as much mental nourishment as possible, which means all the knowledge that is associated to this journey, which means that we're sending you all these pearls via email on video snippets, 3 minutes at a time. And that's called the basic course. But then you'll be eligible for an advanced course that has the latest and the greatest on metabolic syndrome, which we've accumulated from the top scientists around the world. And the interesting thing is that most of the stuff that we learned about losing weight, about diets, about wellness is wrong. Eating several times a day, that's wrong. not eating at all and intermittent fasting that could cause a problem, that concept is also wrong. It actually is good for you. Eating low calorie or doing low calorie programs is not sustainable. It doesn't work. Eat less, move more. That national campaign, it was a global campaign. That doesn't work. It's a lie. Eating too much fat can cause problems. That's a lie too. So there's a dramatic revolution in what nutrition, good nutrition is. And I can always start off by saying the most important thing is keep away from processed foods. How you doing with that?
I'm doing pretty well. I think making so things I've been doing, I still have to make my boys dinner. So I've been ordering like home chef and so or organic based meals. And then that's easy because then I can have some of the protein. I get very full very easily. It's funny because I'm at the point that my stomach's still pretty small, so I have to prioritize my protein. So I'm really looking forward to like good big helping of vegetables soon. Once I get all my protein in, which I never thought I would say. But it's something that I've noticed. I really don't like artificial sweeteners. So initially after surgery, water can be tough. And I was drinking some electrolyte stuff. And I just noticed my taste for that. It's just all too sweet. Like my tastes are changing. And so I appreciate water more than I ever have before, just because I didn't get to have it right away after surgery. It took a little bit of time for my stomach to handle it. And just, I appreciate it just tasting clean. I don't know how else to describe it. Just the artificial sweeteners are just really, really sweet for me right now.
Yep, that's how it works. For those of you that are listening that have not had surgery, your taste buds dramatically change. Your whole inclination towards certain foods dramatically change. The smokers stop smoking. Of course, I make them stop smoking before. The bingers stop binging. The carb addicts stopped carbing. And we want to take it to the next level. We really want to detox, decarb your body, and replenish the gut bacteria. You know that nourishment comes all the way from the soil. The soil is full of bacteria, and that in turn creates a small little ecosystem where plants grow, and we eat the plants, or the animals that eat the plants, or whatever the animal produces. And that's how the circle of life is. But unfortunately, we've been pushed into a modern world where that chain of organic food has been completely abolished. So you have to be very, very specific about looking for non-toxic food, non-processed food, preferably organic. If you don't grow it yourself, grow your own, know your grower, know what your cow eats. It's not enough that it's grass-fed. It's preferably free range, naturally feeding, etc. All these concepts that we slowly are going to include in that basic course for all our patients, because we really want to take it to the next level. And it seems you're doing a good job of it because you're looking for organic food. That's awesome.
The thing, like, I want to let people know that I don't crave like carbs and sugar like I used to. So for me, feeling satisfied after a meal was always dependent on carbs and feeling this full feeling. I get that full feeling with protein now, and I honestly don't crave that sugary, carby high that you get from eating those foods. I mean, that's a temporary high, but I think that was my biggest wake up after the first week and a half, 2 weeks of being able to really eat food. That's been my biggest change. I just don't crave it. And I'm hoping that as long as I keep with the plan, those cravings are not going to come back, especially at the level I had them before.
I'm glad you're saying that, because there is a conscious option. There is an addiction to food, especially to those foods that are, let's say, stimulating. And the biggest stimulus is sugar. It's also the biggest killer. And I got to tell everybody, I mean, if you're not going to listen to anything else, science is now pointing towards the biggest killer identified in our food is sugar. It's fructose. Not the fructose that comes inside a fruit. It's the fructose that's been extracted and processed and in the 800,000 different foods available in the food industry, the processed food industry, almost three-quarters of them have sugar in them. This is the first time, and I always mention it in the shows, that kids are having alcoholic liver disease, but without drinking.
Wow.
Same fatty liver disease. It is rampant around society. Almost half of the people in the US either have cardiovascular disease, fatty liver disease. 8 out of 10 people have one marker of metabolic syndrome, which means that there's an understanding how simple it is to understand that 7 out of 10 people are going to die from the effects of that. So let's revert it, and we're doing it one person at a time, and you are a great example of it. Any closing remarks? Because we're up to the 30 mark.
Just this journey has been really amazing, and I've been sharing it with people on my Instagram and in my life, and it's changing my life, my family's life, my kids' life, because I'm choosing better options. And I'm really looking forward to and enjoying the life that OCC has made possible for me.
Thank you, Desiree. Thank you for sharing. That's like super important because I know you're going to touch more lives. That's why we want you as one of our main influencers. You're going to influence so many lives for the better. And for those of you watching, thank you for listening in. We do this every week as much as we can because I got to do it between surgeries. But if you have any questions, post them online. Share this video with your friends, loved ones, even with anybody who you think may benefit from this, because especially from a women's perspective, infertility can be terrible, and there's so much stuff to do around it. But ultimately, a simple 20-minute procedure can actually do the trick. And by the way, be careful because you're going to be extremely fertile from now on.